Welcome to Chapter 4. Let's review some of the learning goals for this chapter. We want you to understand the historical background of education for advanced practice, to describe external factors that drive demand and influence education for advanced practice, distinguish the advanced practice nurse role from educational requirements for the nurse practitioner, nurse anesthetist, clinical nurse midwife, and clinical nurse specialist, to determine factors that initiate interest in the doctoral of nursing practice, be able to identify and distinguish the DNP from the PhD prepared advanced practice nurse, discuss the process of transition from MSN to DNP for the advanced practice, compare and contrast the doctoral dissertation and the DNP project. This will be a brief introduction. For those of you who will be continuing in your education for the DNP, you'll be given more information a step at a time to help you preparing and getting ready for a project. During this chapter, I want you to think of ways that there can be some synergy between both the DNP and the PhD. I view this synergy as where we are best in our practice. The PhD nurse often creates new research and knowledge. They are based at creating new information. The DNP I view as the person who implements this new information into practice. They are the translation of current research into actual clinical outcomes. We will also be viewing the faculty role of the DNP graduate and look at the future roles of both the DNP and PhD prepared nurse. Much of the changes that you see in the current role of the nurse practitioner is due to societal needs. Basically, there is a great deal of need for healthcare providers, and we answer that role. The Patient Protection and Affordable Care Act brought many changes that have shaped our current practice. In short, this is the PPACA. So the PPACA funded support that established nurse management health centers. They funded school-based health centers. They funded collaborations between nursing schools and healthcare facilities, loan forgiveness for providers willing to practice in pediatric subspecialties, including mental health for those out there doing a psych certificate, and underserved areas, and funding to support independent at home for the chronically ill for Medicare beneficiaries using both NPs and physicians. And finally, the PPACA increased the reimbursement rate for certified nurse midwives for covered services. So they basically took us from 65%, so picture doing a delivery where you get paid half as much as an obstetrician, to 100%. So if you think about this, having midwives practice in rural areas is a great answer to healthcare need. In many of these rural areas, you will have a family practice doctor who actually does not regularly deliver babies, delivering the babies. And I think you add a lot to increase outcomes when you have someone who is personally just trained in baby deliveries. I want to talk really quickly about a study that has driven the advanced practice role to the doctoral level. So Rand Corporation, commissioned by the AACN Board of Directors, found there is universal agreement in the nursing community on the value of a doctorate in nursing practice as better preparing nurses to meet the future healthcare needs. Because of this study, the ACCN Boards of Directors convened a task force to review the state of DNP programs to clarify curriculum and practice expectations as outlined in the Essentials of Doctoral Education for Advanced Nursing Practice. Basically, as this research came out and said that there's great value to having more advanced trained nurse practitioners and advanced practice nurses, they decided to go ahead and make more standards for these training programs, which is something I always look at because we are, as your faculty, trying to meet these standards to make sure that our program meets their current guidelines. So basically, the 21st century has been a significant time for a change in the role of the nursing. And basically, it's starting to recognize nurses' contribution to healthcare. A great example of this is the World Health Organization recognized for year 2020 as the year of the nurse and the midwife. So they have a huge campaign because when you think about the World Health Organization, how do you get more people healthcare who have no access at a good cost? It's actually not creating more doctors. It costs a lot to create a doctor, and you're not getting more providers to more people. So the World Health came out with this campaign to increase more midwives and more nurses, because this is a way to change our healthcare. This is a way to make it so more people have access to care, more people have access to good care. So good shout out for nurse practitioners and midwives and all the different subspecialties within the nursing field. The campaign, what they recognized is that midwives constitute more than 50% of the health workforce and more than 50% of the shortfall in the global health workforce. So basically, it is an answer to a need. And again, as we talked at the beginning of this chapter, that is where we're seeing the rise in the role of the nursing field, as we are answering a societal need for more healthcare. Last stat I looked at when it came to who could access healthcare is like 30% of the population. So there's a great need in rural areas and people with uninsurance to have more healthcare specialty and have more access. And nurse practitioners, certified nurse specialists, psychiatric nurse practitioners are an answer to this call. Many of you are doing a psych certificate. You are answering this call in your community, right? You are providing healthcare services that your community has not had otherwise. So I can't help it. I think it's super exciting time. I love watching how nursing has grown since I started in the field. Let's go ahead and talk about some lingering controversies about the advanced practice nurses and academic credentials into entry for advanced practice. So the American Association of Colleges of Nurses in 2004 voted to support the DNP degree as the entry-level education credentials for APNs, effective as 2015. So this discussion ensued, a huge amount of heated discussion. There's some opposing votes that came out. There was basically, when this came to vote, there was two well-known schools, and one of them had a very highly developed PhD program, and they didn't want to have all this competition with DNP programs, so they were against it. And then also there was some well-known MSN programs that didn't want to all of a sudden have to provide for a DNP program, because providing for a DNP program would also have a lot of costs and also a lot of change, right? So if you're a DNP program, what's the one thing all of your faculty have to have? A DNP. You can't just have all your MSN faculty transfer to DNP. So it would be educating your faculty, retraining, changing the standards of your curriculum. There would be a lot that goes into transforming an MSN to a DNP program. So they voted against it. However, one of their greatest arguments for why we shouldn't do a DNP versus an MSN is they said, well, we have great outcomes with nurse practitioners or advanced practice nurses, so why should we change it? However, this is kind of not a great argument, because the truth is healthcare is ever changing, and it is so much more complex than it once was. When I started clinical practice, which was a while ago, probably about 7 to 10 years ago, what we did back then to what we do now is so different. 50% of what I learned is actually considered obsolete. So the idea of if it worked in the past, it works now, just doesn't hold water. The truth is healthcare is more complex. Our healthcare system is more complex. And I firmly believe that nurse practitioners have a greater need for education. And this is a way that we can do it. Okay, let's talk a little bit about how advanced practice nurses get certified. Advanced practice nurses are prepared through a variety of educational programs with oversight carried by specialty certification boards. This results in different requirements for advanced practice roles. So I'm like dual certified as a certified nurse midwife by AMCB and a women's health nurse practitioner through NCC. So those are two different bodies that provide credentials. And because of that, I answered with I have two different certifying bodies that have very different requirements between the two of them, which honestly really keeps me on my toes. It is not abnormal for advanced practice nurses from different specialties to have different continuing education requirements. So a take-home lesson I have for you on this is to become very good at keeping track of the requirements for your current certification board to maintain your clinical practice, because this is one area you don't want to let lapse. I would never want to retake my boards. Let's talk about some of the current controversies around the doctorate of nursing practice. Some believe that data supporting excellent outcomes for advanced practice nurses is reason enough to not change the master's, just like we previously talked about. Basically, this argument is if it's not broken, then let's not fix it. This view ignores the changes of healthcare system. Some arguments against the DNP program include the extra cost and time and faculty to promote this advanced education and cost to students, right? Every year you're in education is a cost of opportunity when it comes to paying for education, and then also your time to me is cost, things that you could be doing otherwise with your time. So it's a cost to everybody involved. However, in support of the DNP degree, is that its candidates with a practice and doctorate may have better advantage in the job market. Also, for me, the tipping point of this argument is that the doctoral prepared DNP is well suited for a clinical track of appointments. What that means is you guys can become faculty and teach. when I started my training, the DNP had just kind of become more popular, but there wasn't so many DNP programs. And most of my faculty were actually MSN prepared, and they were in the process of becoming a DNP. Because of this, there was just a lot of negative messages that got sent over what a doctor prepared nurse practitioner means. I had a lot of clinical faculty early on in my career who were having to go back to school or lose their position. And so they felt like it was a big waste of time. But in the past, before you had so many doctorally prepared nurses, you actually had a lot of PhD prepared nurses that were teaching, and then you had a lot of clinical instructors that were MSNs, but they actually weren't teaching or didactic coursework. Something personally that I have seen with the adopting of more trained DNPs out there is that these doctorally prepared nurse practitioners or advanced practice nurses or nurse specialists are teaching didactic coursework along with being in clinical practice. I think this is a really big benefit to our students. I hate to say it, but when I was in my training, I had some faculty who hadn't been in the hospital for a decade, taught us things that were so out of practice. I used to think, what are they talking about? I haven't seen this forever. I hope it's of benefit to you that I'm in practice 3 days a week at an ER, that I see patients in clinic, that I actually see what goes on in the healthcare system. So when we talk about the roles of an advanced practice nurse, that I've been there, that I'm not just reading what is written in our course didactic work and trying to bridge the difference. I personally think that nursing education has improved a great deal with the DNP, and part of it is because I think faculty hasn't improved. And for those of you who are considering getting a DNP and you are thinking of a track as faculty, it is a great opportunity. Watching students grow is a very rewarding process, but you also don't have to give up your clinical practice. So it's, to me, one of the greatest benefits. It's a tipping point for the DNP, is that you can kind of have your cake and eat it too. You don't have to dedicate your life to a PhD and clinical track, a PhD and like a tenure track, but you can have both clinical practice and an education emphasis. Okay, so let's talk really quickly about the DNP practitioner focus model. This can actually be traced back to Mary Mundinger of Columbia University Schools of Nursing. She basically performed this innovative project at Columbia University on the NP model that ultimately led to the development of the clinical doctorate, which was finally approved in 2005. So I kind of view her as the grandmother of the doctoral level of nurse practitioning. Okay, let's do a quick knowledge check. In which year is the DNP requirement for entry into practice for a clinical nurse specialist? And remember, there's different guidelines with the different specialties. Okay, the answer on this is 2030. In June of 2015, the National Association of Clinical Nurse Specialists endorsed a DNP degree as an entry-level requirement for CNSs by 2030. On this one, I think 2015 was tempting because that was the Advanced Practice Nurses Guidelines. So this question highlights a little bit about keeping track of what credentialing body you're talking about, because they have different guidelines. I think it can get easy to get tripped up in the different guidelines for providers on the same level of care. Okay, so in support of the doctoral level nursing practice is the evolution of healthcare. It is far more complex and requires way more education than the past. NPs also need to be comparable to other healthcare disciplines, such as other fields have gone to a doctoral level, right? So there's a clinical doctorate in speech, clinical doctorate in physical therapy, occupational therapy, respiratory therapy, all these different clinical specialties have gone to a doctorate. So I feel like if nursing doesn't follow, we will be left behind. The opposition is basically that if it's not broke, don't fix it. We've talked about that. And again, there are challenges to the current master programs to educate faculty and to basically meet the new demands of a high level of education. All right, another knowledge check. Which rationale provides support for the requirement of a doctorate in nursing for entry into practice? The current master programs lost the required credit hours. The current master's program has a proven history of excellence. Healthcare services are decreasing in cost, and health disciplines are failing to deliver optimal health outcomes. So the right answer on this is basically healthcare disciplines are failing to deliver optimal healthcare outcomes. The biggest cause for wanting a DNP is that we can improve patient outcomes, right? So basically, whenever we see a rise in healthcare errors, patient safety issues, the evolution of roles of providers, and a failure of the healthcare disciplines to deliver optimal outcomes, we answer that with better training and education. So that is why we're getting a DNP, not because MSNs aren't providing good education, but because we want to provide more education. Okay, let's have a quick discussion. I want to read you a situation. I want you to think about what you would do in this situation. You are a tenure-track faculty member in a university's nursing program who holds a DNP. This year, you are being considered for tenure. As such, your institution is considering your accomplishments and credentials. In addition to holding your DNP, you have also conducted original research, published in numerous peer-reviewed journals, co-authored a nursing textbook, and have provided primary health care free of charge each week at a local free clinic. Even with these accomplishments, you are worried because many of the people reviewing your tenure materials have their PhDs and are unfamiliar with the DNP. Think of ways in this situation you would write a cover letter to accompany your application materials to explain the background and merit of a DNP in the tenure review committee. Using materials from the book, write a cover letter. Basically, the goal of this cover letter is you're trying to show the tenure committee who all got their PhD, so they strongly understand that track and what it took them to get there. So there might be some slight bias that that's the best route. That a DNP is not a PhD light, but rather it's a rigorous professional practice terminal degree. So if I was in this position, I would actually kind of quote the essential to the essential doctoral education for advanced nursing practice. This specifies that clinical scholarship and analytical methods for evidence-based practice is an important component of the DNP curriculum. I would discuss the growth of the advanced practice nurse due to the doctoral level education and the rise of the DNP prepared faculty. Basically, I would want to talk about how we're preparing DNP level nurse practitioners and advanced practice nurses, that we need to have more faculty that are on a tenure track that are DNP prepared versus PhD prepared, because I would be uniquely prepared to help the students achieve their doctoral project having gone through the process. The reason I brought up this case study, because I thought it was interesting. In reality, it is hard for DNPs to get a tenure position. They do get faculty positions, but they typically don't get tenure. And I think this is basically because the path is new, and the DNP project versus the PhD dissertation is more new. So you can see some varying in programs what the DNP project looks like. And I also feel like a lot of times on a tenure committee, it's a whole group of people who got their PhD, and they might not always know what it took you to get there. So when I think about this, I view it as your responsibility, if you ever find yourself in this position, to let that group know what it took to get there and what you bring to the table. So this is basically one of those situations that I think it's very important to let them know how you're improving practice, what it means to be a DNP versus a PhD, and what it means to be faculty. Okay, let's talk just a little bit about the DNP. So both PhD and DNP programs are both doctorally prepared, but there's some differences between the two. The DNP graduate engages in advanced practice nursing roles. So they're becoming a nursing leadership, right? So when you are the clinic, the provider at the clinic, you have a leadership role over the nurses and the MAs. They also evaluate and improve healthcare. So I expect the doctoral nurse practitioner to be able to look at their clinic and see areas that aren't going well and to make those changes. They practice in collaborative research. So the doctorally prepared nurse practitioner oftentimes will be implementing the clinical portion of a research project. And then they advance the profession. Advanced practice nurses are bringing advanced education and are able to improve on basically, I think, the nursing field in general, right? We're bringing a doctoral level to the table. And then the final project versus a dissertation. I think a dissertation is what everybody thinks of. It's that 6-step process. It has a committee, it has a board, and then at the end, you're going to defend it. A final project or capstone requirement does not always require that. It does require, though, that you are implementing healthcare knowledge. All right, so this table actually contains examples of complementary residency experiences in the DNP and PhD program. So this means, in short, basically, that both nurses doing a PhD and DNP have some areas that overlap. So both of them are doing literature reviews. Both of them are participating in quality improvement or pilot research, participating in full scope research, development of capstone with mentors. It's letting you compare and contrast what these residency programs look like if you're the DNP versus the PhD prepared advanced practice. Okay, let's talk a little bit about the expectations of the DNP. One of them is that they become leaders in evidence-based practice. The DNP graduate should have competence in translating research into practice, evaluate current practice for improvements of reliability of healthcare practice and outcomes, and participate in collaborative practice. Research-based doctorates should focus on cultivating new knowledge, ultimately improving practice outcomes. A DNP project should translate research into an area of practice. There is a lot of variety in the projects. Some require dissertation type project with the committee, as we talked before, and an oral defense. Other are just like a systematic review of literature on the clinical topic. When we talked about that situation in the past with the that case study with the faculty trying to get the tenure, I feel like this would be a good point on that cover letter that you're writing to also discuss what your capstone was, because there's so much variety in what a capstone is for the faculty trying to agree whether you should go on. They actually don't know what you did because it's not so standardized. This is where I would try to discuss what I had done so that they understood what it looked like and what it curtailed. That way they can understand what my DNP means. So I want to tell you a little bit about my own doctoral project. I created a group prenatal care program for women on methadone and Suboxone therapies. So I wrote this program. It was about 200 pages long. I completed a 14-week program and did pre and post evaluations to evaluate the education that was provided in the course. The data was compared against other research that had been done on women just for group prenatal care to see if group prenatal care was as beneficial in this certain subset of women who are on Suboxone and methadone. Ultimately, I presented this in a project at WIN, and most of the projects there were PhD based. So in short, I did not feel like my project was less than a PhD dissertation, and I also defended it in dissertation style because that's how my program was. They're just different, right? It was the application of what we knew about group prenatal care currently to a different subset population and gathered some data. And ultimately, it was very fulfilling to be able to read research and see how it worked with the patient population. So for me, my preference is in a DNP just because I really like the application of knowledge. So let's talk quickly about the DNP and the PhD collaboration. There might come a time in the future where all advanced practice nurses complete a DNP, which will form a firm foundation for all the PhD students in nursing. There are many DNP and PhD dual programs that will attract those who are serious about both practice and research. Ultimately, when you're picking between DNP or PhD, it should be based on your practice role. What do you want to do? Like for me, I want to read something and I want to see if it helps improve patient outcomes. Or do you want to find the new knowledge base? So when you're thinking between the two, if you're thinking of advancing your nursing career after you've done the certificate and you're thinking, do I do a DNP or PhD? Try to think of like where you see yourself. Do I want to create new knowledge, or do I want to take some research that's out there and see if it is actually applicable? And that's how I would choose between the two. Both will take some time and both will stretch you. Let's talk shortly kind of about what faculty's role is in helping you in this process. When I started my DNP program, if someone had told me the project I just did was going to be the end result, it would have felt like too much. I think I might have just stopped in my tracks. This is where your faculty has a role in the process. How do you eat an elephant? A bite at a time. Faculty will help create a support system, help you find experts in the field that you're researching, and provide you with guidance along the way. We have been where you want to go, and we view our job as getting you there. If you continue along the path of a DNP, it will be a step at a time. You won't be ready for it now, but every day you'll become more prepared and get there. And faculty, it is our job to provide you with the resources, the support, and the knowledge base that you're successful. And many of you, having listened to your introductions and your discussions, would be wonderful candidates for a doctoral program. Okay, and let's talk shortly about some health research nursing trends. Nursing, typically we get the short end of the stick when it comes to NIH funding. We get less than 1% of the budget. Nurse research conducts studies that are key to managing chronic conditions, usually health promotion and end-of-life care. Nursing has a promising trajectory, considering that we have more people enrolled in DNP and PhD programs ever than like in the past than we have. When these two terminal degrees work in tandem, it's vital to the growth of research and nursing's presence in research. But historically, we haven't had as much seat at the table when it comes to research in healthcare. And so that's another reason I love seeing this DNP and PhD push, as I'm seeing us more actively participate in the research shaping the outcomes in healthcare. Okay, we're going to shortly talk about the Rush unification model for nursing. So Luther Chrisman proposed the Rush unification model for nursing. This requires that all nurses have advanced education to practice. His model incorporated interprofessional teams composed of physicians, nurses, and other health professionals practicing together. Chrisman believed nursing would only receive parity with other professionals if all possessed terminal degrees, hence the phrase the unification model. View it as we're all on the same level at the table. A doctorate of nursing is one way to achieve this parity. Let's do one more knowledge check. What does the Rush unification model for nursing recommend? All nurses have Bachelor of Science nursing degrees in practice. All nurses work 12-hour shifts. All nurses have advanced education to practice. All nurses have doctoral degrees to practice. So the key to this is that all nurses have advanced education to practice. Okay, just in summary, advanced practice nurses have the ability to fill a need in our current healthcare system. From research to clinical practice, many of you are getting a psych certificate and will meet healthcare needs in an area of underserved, increasing access to mental health in your community. Whatever the discipline, nursing can be an answer to increasing access to healthcare, cultivating new research, improving outcomes, and improving nursing education. Thank you so much for your time.